Creutzfeldt-Jakob disease, or CJD, is a rare and degenerative brain disorder that falls under the category of prion diseases. These conditions are caused by misfolded proteins known as prions, which can lead to brain damage and a host of neurological symptoms. CJD is particularly concerning because it progresses rapidly and ultimately leads to severe impairment and death. The incidence of CJD is low, with approximately 1 or 2 cases per million people each year. It usually strikes in older adults, with the average age of onset being around 60 years. There are several forms of CJD: sporadic, hereditary, and acquired. Sporadic CJD, which accounts for about 85% of cases, occurs with no known cause and typically arises spontaneously. Hereditary CJD is linked to genetic mutations and can run in families. The acquired form, sometimes referred to as variant CJD, is associated with exposure to infectious prions through contaminated materials, such as certain medical procedures, or through the consumption of infected beef products linked to bovine spongiform encephalopathy, commonly known as mad cow disease. Symptoms of CJD can vary, but they generally begin with subtle behavioral changes, including memory loss or personality shifts. As the disease progresses, patients may experience rapid cognitive decline, visual disturbances, and coordination problems. The hallmark of advanced CJD is the development of myoclonus, which is characterized by sudden jerking movements. As the brain tissue deteriorates, patients may also experience difficulties with speech, movement, and eventually enter a state of coma. The disease typically progresses over a few months to a couple of years, with most patients succumbing to the illness within a year of diagnosis. Diagnosing CJD can be challenging, as its symptoms can mimic those of other neurological disorders. Physicians often rely on a combination of clinical evaluations, neuroimaging techniques like MRI, and analysis of cerebrospinal fluid obtained through lumbar puncture. One of the most telling markers in the cerebrospinal fluid is the presence of specific proteins associated with prion diseases, including the 3rd of March 14 protein and tau protein. However, definitive diagnosis often requires brain biopsy or, in some cases, an MRI that shows characteristic changes in brain structure. Currently, there is no cure for CJD, and treatment primarily focuses on supportive care to manage symptoms and maintain quality of life. Palliative care plays an essential role as the disease progresses, offering emotional support and guidance to both patients and their families. Research continues into potential therapies aimed at halting or slowing the disease, although progress has been limited due to the complexities associated with prion biology. Preventing CJD from spreading, particularly in the context of variant CJD, involves stringent regulations surrounding food safety in medical practices. For instance, the use of certain cattle-derived materials in medical products has been restricted in many countries to minimize the risk of transmission. In conclusion, Creutzfeldt-Jakob disease is a devastating condition characterized by rapid neurodegeneration driven by misfolded proteins. Its manifestations can lead to severe cognitive and physical decline, presenting significant challenges for diagnosis and treatment. While CJD may be rare, its impact is profound, affecting individuals and families profoundly. As research continues, healthcare professionals hope to develop effective interventions that can address this enigmatic and alarming disease. Thank you for learning about Creutzfeldt-Jakob disease today. Stay informed, and remember to look after your neurological health.